So just so that we have, if anybody comes in later or missing it. So well, welcome everybody. If you have anything personal to me, send me a message. I know some of you are able to get a hold of me. That's fine.
Got it out.
The what?
I finally got it out, I think.
Okay, great. So yeah, we may have some people join late. Again, apologies that this is a little miscoordinated today because Ashley got COVID. We wish her quick recovery, hopefully without another episode of long COVID. Otherwise, our practitioner, our director will become a patient, I guess. But I guess that's the whole point, no? Anyway, anybody has an offering?
I have an offering. Yes. I wanted to a shout out to Steve, who was a month or so ago kind of raving about breathing practices and how much it had done for him, and about the book Breath, and also to Ashley and Dr. Kogan for teaching us coherent breathing, because I've been doing coherent breathing every night, and oh my God, unbelievable. I mean, it's done wonders for my sleep. I have had restless leg for about 15 years, and since I've been doing coherent breathing, it's I mean, knock on wood, it's been a month since I've had restless legs. So thank you to everybody. I also want to thank Steve for raving about the CIM as practitioners, because first I joined the long COVID group, not sure whether I wanted to, shell out the money to become a patient. And now that I have, I'm just so incredibly happy, so grateful.
Thank you, and let's all realize that.
Now, I will tell you, this was not planned. But today, everything's about breathing. I'm not kidding.
No,
I had to prepare something in less than 12 hours. So I've had, I just recorded the box breathing, and I've been teaching it lately. So we're going to definitely do the practice, but I also have two other pieces that all about breath. So it couldn't be more perfect.
Well, let me make a disclaimer that all that praise, thank you, and definitely ultimately all goes to Ashley and Dr. Kogan, because they're the ones who always recommend the things to us. So I only pass it along from them.
Yeah, but you're a very convincing salesperson.
Well, thank you.
All right, so Ashley's not here. There's one thing I can do. So remember she mentioned before we drop into the breathing. So who's here knows what GammaCore is and the whole thing? Just one person? Two people? Okay. So the GammaCore is this FDA-approved device for headaches, but it's been in a rapid increase of its use for long COVID. It's basically vestibular nerve stimulator that's external, and it's safe and it's pretty effective. There's a lot of vagal nerve internal stimulators that get implanted for vagal dysfunctions. Those are very expensive, and of course, I mean, piece of equipment sitting under your skin, there's problems with that, obviously. This is external. We had the reason I'm bringing this up is yesterday we had a staff meeting, and their team came to talk to us about the equipment. So I had a lot of time to reflect, and while they were talking, also Googling things, reading their articles, etc. And it's a powerful device. There's no question about it. If you have a headache, Jeff, particularly for you, I think it's definitely worth a try. I'm a little perplexed by their marketing strategy. It's the most bizarre marketing I've ever seen. They're not selling the device as a little tiny box that looks like a TENS unit that should cost $100. But they claim that because of FDA approval and because they actually formally contracted with VA, and VA is heavily using them, there's a very high price of the device at $1,250. But because of that, they basically don't sell it to you. They rent it to you at 3 months blocks at $450 for each 3 months. And when 3 months runs out, device turns itself off. So like, I was like, what? I mean, American medicine for you people. Like anyway, so, but the device itself appears to be robust. So we're ask them to give us quotes and set us up as a practice, at least so that we can think about whether we want to sign up. We could potentially simply, if like Jeff really wants to try it, we don't have to be their participants. We can simply fill out the paperwork, either myself or Ashley, and send it out to them, and they'll contact you and they'll send you the equipment, and you just pay them directly. So that's an option. Of course, we would prefer to figure out the model where we make it easier for patients, because filling out paperwork, mailing things back and forth, and it's just whatever. Long story short, they also, of course, marking it up to you. Like, we could at least pass out some discount because they're giving us wholesale pricing for this. As I said, typical American medicine at its best. So I was like, wow, wonderful device, but boy, you lost me in 5 minutes of your marketing strategy here, and good luck with that. They are claiming that some insurances cover them completely. So that's one advantage also. So, if we process with all of this, we definitely going to be working through the insurance first, if it's possible, just like anything.
So Dr. Kogan, I used it because my I'm sorry, what do you call it? Osteopath let me have it for free for a few weeks. And I foolishly didn't use it consistently. I was on and off because of some issues. So I didn't get a lot out of it, but I got some out of it. And I think if I would have used it consistently, I would have got more. But
Probably.
I teach marketing at Pamplin College of Business, and I'm using this company as a case study of what we call aggravated pricing strategies, because yes, you can't buy it, and it's $200 to $400 to $800 a month. My osteopath just said, Steve, if I don't report that I've got a patient on it right now, it just sits in my office. So just take it for 2 weeks and see what you think and bring it back.
Anyway,
he didn't charge me. He didn't fill out any paperwork.
Well, he paid it for you, basically. Unless they give it, they claim that they can give some free equipment to practitioners. And then until I see the paperwork more and I wrap my head about this madness, I'm going to just that. All right. I'm always trying to be cost conscious. And when they were giving a presentation, I was like, Jesus, this is what I usually never get myself into. But there's nothing like this on the market. It's not a glorified TENS unit, if you ask me. It's a very specific wavelength of the electric conductance, and it's very gentle. And they have studies to prove it. So, if you use a TENS unit for pain of your back, by all means, but if you can't use your TENS on the neck. It could shock your vagal nerve into and have you arrested, have your heart arrested. So you really can't do that. It's not. Yeah, this is a much higher potency electricity. You could have serious problems. Vagal nerve goes right here on the neck, and it's only about a half an inch below the surface. So it's pretty close by. That's how they reach it. The device gets, you put it like this. Hold on, let me see if I. So this is the actual equipment. So what you're seeing here, this little thing, there's electrodes. So you take that lead off and you put it right on the neck, both electrodes, right around the vagal nerve. And that's what stimulates it with these two things. And then they're like, you put a little, it's like a ultrasound gel solution first for better conductance. And then you put it in. It's like 2 to 3 minute treatment. You can do it multiple times throughout the day. They don't limit it. If it's very effective for controlling headache, and if it takes the headache away within 2 to 3 minutes, then you can use it up to 30 times a day. But again, out 24, they say here. I guess this is a little outdated. They have several different equipment, different types of. So, okay, well, I don't want us to take the whole time for that. Okay, so the things I wanted to talk to you about. First of all, there was a study 2 weeks ago that I was reviewing, and of course now I don't see it, which pointed out at the very profound effectiveness of the continuous physical therapy for the breathing on improving long COVID symptoms of shortness of breath. It's interesting that the treatment was self-directed exercise for diaphragm. And what I'm going to do today, I'm going to basically, I'll make myself a note that I will send you the actual study at some point if you care. But what I was thinking, how to sort of mimic the approach that they used. They were sending people to special physical therapy. We probably don't have access to exactly what they did in the trial, but we could do something a little different that's probably going to mimic this very closely. They concentrated on basically learning to expand the chest and maintaining a deep continuous breathing, and that seemed to do the magic. So basically, like if you think about this, it makes completely perfect sense, right? The diaphragm is the muscle. It gets hit very heavy with any acute respiratory infection. With most of them, it comes back right back up and you don't have a problem. Turns out that somehow with COVID, that impact is way prolonged, way longer. And a lot of people, it just doesn't normalize right away. It takes many months, if not years, to get this normalized. So it makes perfect sense to use this specialized physical therapy approach to train the diaphragm to work better. This is probably when Steve was talking about an osteopath being so effective. The osteopaths spend tremendous amount of time working on diaphragm. They have different techniques where they can release the diaphragm. They often teach patients how to do the special breathing for diaphragm. We're going to bypass all this because none of you are going to be easily able to show up to some osteopath's office. Plus, it's going to be additional expense. Plus, it's just a lot of back and forth. So I'm going to show you a couple of things. First of all, we're going to do the box breathing, which is in itself is going to teach you to hold an expiratory breath. We all know you inhale, you hold, fine. The problem, inhale and hold, you're not training your system to tolerate rising CO2. You're only training yourself to be okay with less oxygen. That's not why we're short of breath. We're short of breath typically because the CO2 is rising. And unless you train yourself to tolerate it better, you're not going to get out of that state. It takes a lot more to trigger oxygen deprivation sensors than the CO2 rise sensor. So basically, most of the shortness of breath has nothing to do with low oxygen. Those are rare cases of inpatient ICU when people's saturation is like dropping below 90%. None of you sitting right now having this problem, even if you still feel short of breath. You feel short of breath because your system cannot tolerate rise in the bicarbonate, and because of that change in the pH slightly. So the first thing is to learn to hold a breath on exhale. If you, going back to Anne's point, the Nestor in breath has an entire chapter dedicated to this. I think it's actually more like 2 chapters. So if you haven't read the book, definitely read it. I'll put the link in a second in the chat. But I'm not going to go and describe every little detail. He has a whole system explaining how to grow a holding of the breath on expiration. If you want to do those Buteyko technique, if you want to do some of those other techniques, by all means. Today, we're just going to do square. And in my opinion, square is almost as good, and it's a lot easier. And in some ways, square is also more balanced. And I will also give you, I actually had a couple of people report such a good benefits that I even recorded the video on square. So what I'll do is, as part of today, when I follow up with everybody, I'll also will send you guys a link to that YouTube video. Who's here actually read the Nestor's book? Can I see hands? About a half. Okay, well, you have homework. You can listen to it if you're having a hard time reading. It's a kind of a bestseller, so it's definitely an Audible and it's easy to read. Do not get like a summary of breath because it's crap. You know how there's like this Amazon summaries? Please don't get that. It's missing most of the important things. Okay, so I'm going to give you a link to this first, and then we'll move to, I think it's worth to do the practice first, and then I have the way, actually, let me talk about the other part of exercise first, and then we'll do the practice. Okay, so this is the link to the master's book. So the next link is to a piece of equipment that if you're short of breath, I'm definitely, and it's all Amazon, it's just easier that way. I mean, maybe you can save a couple of dollars somewhere else, but you know, all of these things are pretty cheap. So the next thing that you can do instead of physical therapy is using this piece of equipment. It's actually highly validated. It's FDA approved. And it's FDA approved for certain things, not necessarily for what you have. It's FDA approved for like certain types of pneumonia, post-pneumonia recovery. It's not necessarily applicable here. But the principle is, so you're familiar with the idea of incentive spirometer, no? You guys heard that term? So basically, incentive spirometer is, let me first put the link. So this is the link to the equipment. So first is the book, second is equipment. Let me share my screen and then I'll show you a couple of things. So this is the actual device that I'm talking about. It's called Breather. This is the more up-to-date or more modern version of the breathing exercise, which will help to expand the diaphragm. Are you seeing the Amazon page or my other screen? Okay. So the old type of incentive spirometer, misspelling it, of course. Spelling has never been my strong. Okay, so the old types of incentive spirometers look like this. You go in a hospital, you get admitted, you have pneumonia, and then part of like typical thing, they give you this little thing. And what you do, you take a deep breath and you're trying to get the balls up in the air. So this is a modern incentive spirometer. And the idea here is that they can control the resistance to your inhale and exhale much tighter. With this balls, there's no control. It's just only one preset parameter, and you're just trying to do your best to get it up. They use it, the numbers on the incentive spirometer actually mean something. It's your what's called inspiratory, expiratory volume, or vital capacity, sometimes it's described as such. But there's no real progressive treatment here. So it's a very low cost device. By all means, you can get that if you prefer, because it's a little bit more visual than this. But this is not only allows you to set the resistance to both inhale, exhale, but you can also connect it to your phone. And it can track what you're doing. And more importantly, you can gradually increase the resistance level. And from my reading, when we did we actually had a student who did a complete assessment of this. And I don't know if I have a written, it doesn't matter. But basically, this equipment price-wise and the quality-wise kind of was the number one. There is a couple of devices that are way more complex and sophisticated, but they're way more expensive. But between the others and this one, cost-wise, level of effectiveness, this comes very high. So if you have continuous dyspnea still, whether dyspnea is when you're resting, when you're walking, or when you're anxious, definitely get this piece of equipment. And the way to use it is similar to how you would use this, which is you would use it for about 5 minutes a day. You do, with this equipment, the recommendation was you do 10 breaths every couple hours, which would be about 5 minutes a day. 10 breaths is about 1.5 minutes, give or take maybe 2 minutes. And so you do this a couple hours, and maybe every 3 or 4 hours. With this one, general recommendation is you do more time-based, and you're not necessarily sitting there calculating the breaths. And once you start playing with the device, you're also going to quickly figure out your own limitation, and you have to continuously push the limitation. So the major advantage of this versus that, in addition to using this for a symptom, you can actually use it for training, basically expanding capacity. So if you're interested in running, swimming, or anything that involves continuous significant effort, you could train your lungs to be literally performing better in the long run for endurance training of any kind. So it's actually used quite a lot by athletes. And athletes often use devices like this, so there are other devices. But this one is a little more expensive, but FDA approved and a lot more advanced because of its connection to the phone. So, okay, and actually it's kind of funny that there's a video here of this girl. So if you notice what she's doing, she's breathing in aggressively through it, trying to expand her lungs. In essence, this device does exactly the same. But when you take that breath, you're pulling through resistance. When you're pulling through resistance, you're pushing your diaphragm. The exercise that was done in that study was very similar. They give a special positional resistance training that allowed for a larger expansion of exercise. And again, I don't know how to train anybody in this, and this was my idea to kind of show you this equipment. So I'm going to pause. I talked for a while. Let's have a little bit of discussion before we drop into the practice.
I have a question for you, Dr. Goy.
Sure.
So I used to be an athlete. I about 5 days a week, intense exercise, run, bike, swim, and weights. And I haven't exercised since long COVID in September. So I'm only barely walking a few minutes. If I were to do something like this, which I'm doing different breathing things from the book, would the fact that during long COVID now, I never used to take my heart rate a lot, but obviously my heart rate seems pretty high now when I do simple things like I'm just folding clothes or whatever, and I'm up in the 90s or 100, and I don't think I would have normally been there. Will doing this actually affect anything about heart rate?
Well, yeah, I mean, the moment you put resistance into the chest cavity, expect the heart rate to rise, because the heart's gonna work against higher resistance. In fact, if you're interested, you can do an experiment. This is called respiratory heart rate variability. You take a deep breath and you hold, and you're going to notice your heart rate's going to start going a little faster. That's because you raise the pressure inside the chest, and now heart has to pump the blood towards the lungs against that raised resistance. So, Steve, the reason this is happening, it's basically deconditioning, because you're raising the pressure, but the heart is deconditioned because you haven't been exercising as you used to. It's all relative to your baseline. So it has nothing to do, like, you could still be 10 times more conditioned than somebody else who's couch potato their whole life. But to you relative, I'm not picking anybody. I see people smiling. That wasn't meant to be a comment. I'm just putting the comparison to him. And so, but relative to you, if you lost even 20% capacity of the heart pushing blood forward because the heart muscle gotten weaker, you're going to feel a massive difference. And the more athletic, here's the kicker. From what we've seen, the people who've been the most athletic, who fell horrible after COVID, they are the hardest ones to recover. That's what we've been seeing. And actually makes a lot of sense, because if you can't rebuild the capacity you've had before, so it's not necessarily that they're hardest to recover. They just have more symptoms as it relates to the baseline. So so to the environment around you, to people around you, they're going to say, "What the hell? You look totally fine," but you don't feel fine because that's not your baseline. It's like basically saying to the world champion in running, who suddenly lost 2 seconds on 100 meters, and now it's not even in the top 1,000. For that person, their whole life is going to be over, in essence, right? So in that sense, it's like that. That little variation, that's only a few percent points, 10, 20%, it actually feels massive. But
I was hoping that also, though, that being in shape maybe means that it's
think. Yeah, that's what you would think, and I don't know if that's true or not. I intuitively would say it should be true.
I mean, just in general, like that COVID hasn't as much harmed my lung and heart.
See, I don't think that this is about. I think this is where I think that's the power of that study. Somebody in the study who designed it felt like, look, we've been scanning thousands of lungs, and sure, some people have residual glass opacities and internal lung problems, but most people have nothing. So why are these people not recovering? So whoever designed the study felt like, well, maybe it's the strength of diaphragm that is the biggest problem, and they're clearly correct.
Got it. So this stuff can actually help the others.
Well, that's the whole point. This device is designed to, or any incentive parameter for that matter. The whole point is to design to teach the re-educate lungs to expand more. And the best way to do it is to build up the diaphragm capacity and diaphragm strength, because you can only do so much with the chest. Usually that part is standard, like whatever you've been doing pre-COVID and post-COVID is going to be the same. It's unlikely that that your chest wall muscles got so weak. The diaphragm is a very different muscle. It's not something we routinely know how to work with. If you are experienced yogi practitioner, you're probably in a major advantage because some of the yoga practices engage diaphragm differently. Or if you play some musical instruments, so like any kind of what are those instruments called when you breathe?
Wind instruments.
Yeah, wind instruments. So especially like didgeridoo and some of those circular breath devices, there's a belief that musicians who do that have a very profoundly better diaphragm capacity than an average human being like you and I. But beyond that, there's no structured way of training, and there is something called pulmonary rehabilitation, which is very convoluted, covered by insurances only for a few indications. Probably for COVID now is covered, but it's very few places that do that. GW, I mean, they have something that they call pulmonary rehab. It sucks. It's terrible. They have a decent cardiac rehab, but not the pulmonary. It's a very specialized treatments.
So would this be a good idea then if I can't go out and exercise obviously right now, but I can't even
That's
walk?
exactly my point.
I'm not going to exert as much as I would if I got. Okay.
My point being is if the diaphragm in your case, Steve, is a major issue and you're currently not engaging it, this is the way to try. And so I strongly recommend if any of you, now if you don't have a dyspnea and your exercise capacity is close to baseline, I don't think this is going to be very helpful for you. I think the breathing practice we're about to do in a couple of minutes would be, because it's more of a nervous system balancing in addition to just teaching the system to be more resistant to the carbon monoxide rise. But if you have anything with the breathing that you concern about, I definitely would suggest trying this. I mean, this may be the best $50 you've ever invested.
Dr. Kogan, I just wanted to actually go one step further with what Steve was saying with my tachycardia. Like if I'm standing for more than 5 minutes, my heart rate will go up to the 140s.
That's different.
Yeah. When is it like too much? Like when should I not push it?
Well, I mean, you can do this process laying down even, right? It's just, I mean, somebody's joining us. You're just going against resistance. So you don't have to be, you don't have to sit up or stand up or walk around. I mean, you could potentially go there. Like I know that some of the elite athletes using this device while they're exercising. I mean, that's not what I'm talking about. Just start out with whatever's comfortable, even if it's just laying down.
Okay.
140 if you stand up. That's I mean, your autonomic instability is raging, unfortunately. By the way, that's good that you brought this up because you should definitely practice the box breathing then.
Okay.
Now, whether or not that GammaCore we discussed, they're claiming that they're using it for POTS, and actually that's what Ashley used it for. So when she's back, we should talk to her about.
Okay, I will. And yeah,
experience about it.
I finally got my first appointment with the POTS clinic at Johns Hopkins, and we're setting up the tilt table test, but I'm pretty sure we're all pretty sure I have it.
Very good. Don't get too disappointed if the long-term results of the whole process there is not matching your expectations, because our experience is it's a very difficult condition to treat. And even Hopkins, probably the best place. Actually, Hopkins is the one, they're using GammaCore heavily. So they may actually literally talk about that and practically prescribe it, because we're not set up to prescribe it just yet. We will be in the next few weeks, but not yet.
Okay, thanks.
But it's just generally people often, it feels like they go to any POTS clinic and then they feel like, well, they diagnosed me, but I'm not a whole lot better because there's not like magic bullet to this.
Oh, I'm very aware.
Yep. Okay, if you have fatigue but not shortness of breath, is this a good idea? I don't know. It may be if the fatigue is actually linked to some of the oxygen CO2 shifts. It's possible, but I don't think it's the same thing. I think that we're talking particularly about subjective feeling of being short of breath, regardless of what physiologically is happening. So this kind of idea that you're not getting enough air. And again, this is interesting, right? So the air hunger itself is not because you're not getting enough oxygen. So I just want to repeat this so that you guys are very clear about this. Most of the time, it is not because oxygen is low. Most of the time is that you don't know how to tolerate the CO2. That's a very that's a shift in perception. I already knew this before I read Nestor's book, but his book helped me a lot to understand the actual dynamics and what can you do about it. So that's, I think, that the main achievement of the book is to really re-educate the public. We always thought about, oh, it's about taking a deep breath and it's always about getting oxygen. And turns out that's less than a half of the story. And the bigger half, so to speak, is the really being able to tolerate breath, exhalation, hold. Yeah, Steph.
I've just noticed this over the years of time. It feels like I almost have a knot. And I've had chest x-ray that doesn't show anything. Could that just be from irregular breathing patterns that it
could also be that what you're feeling is some kind of a pull of a diaphragm. Like, so this is why I love osteopaths so much, is because they often will manually within a few minutes tell you, oh yeah, you know, this is off balance this way because your diaphragm is not functioning. And you know, they often will say, they will put their hands on your chest and they ask you to take a deep breath and say, oh yeah, you know, your left diaphragm is inactivated and your right is fine. Like,
I mean, I can point to it very easily, exactly, and it's always in the same space. I used to be like Steve, but with yoga, like every day. Now I don't do it as much, but I try my best to do things like this and try and expand out. But it feels like this weird, like tightness in one specific, in the middle of my chest. Yeah. So you think that's a diaphragm?
that could be. I mean, it could be that. I mean, I can't comment on that, if you know, but even if I examine you, I'm not really good at this. I mean, I have some basic skill of assessment, but I wouldn't trust myself, to be honest with you, at this point. Especially since COVID, I haven't been practicing as much of the basic osteopathic assessments. I still do some things myself, but usually I just refer out right away. My preferred place for assessment is actually not an osteopathic. It is specialized physical therapy place called Thrive Again. I'll put the link. And I actually interviewed on my Zoom, on my YouTube channel, I interviewed the owner of the place because I've been working with them for a long time. They basically are osteopaths, even though they're all physical therapists. In essence, it doesn't matter who does the manipulation. It's a functional assessment of how your body moves. And the diaphragm is a massive part of that. That's what every functional physical therapist or functional osteopath or well, I mean, the ones who work with their hands, not with the writing prescriptions. So those are the ones that would really concentrate on that a lot. Okay. So we can go a little bit longer since we kind of were disjolted in the beginning, but maybe a couple more questions and then we'll do the practice. Does that sound okay? All right. So yeah, any other reflections on the whole thing? All right. Well, why won't we just do the practice and then see if we have a reflection on the practice? Okay. All right, so whatever position you're in, it's fine. You don't have to be sitting down if you feel like you need to lay down. It doesn't matter. You know, the only thing I'll ask you is don't close your eyes in the beginning because I may gesture certain things, and so once we get in the rhythm of it, then you can close your eyes. So the process is quite simple. It's literally a box. I'm gonna put link to my video that I just did so that you can see the picture on the thumbnail has a picture of literally a box. So each side of the box is the same. Inhale, hold, exhale, hold. Every part is a square. So if you start with, let's say 4, then your inhale for 4, hold for 4, exhale for 4, hold for 4. And that's what we're gonna start. 4 is, most people should be able to do it. If you get short of breath after 2 or 3 breaths with 4, go down to 3. If you're still short of breath with 3, go down to 2. You should be perfectly fine with 2, because count of 2 times 4, it's only 8 seconds breath, right? So if you're doing each count roughly a second. So 4 would be 4 times 4, you know, it's 16. So you're doing about 4 breaths a minute. It should be quite easy for everybody. But, you know, if not, then also, if you have a problem, just raise your hand or type something in the chat, whatever you prefer. Okay, any questions on instructions? You can click on the link to go to YouTube and then just put the thumbnail on, just in case you forget something. And the thumbnail, that pink picture on a thumbnail, that actually has 4 seconds for each side. So the biggest problem or the biggest mistake people do is when you take a deep breath in, you kind of don't do that. There's no like this kind of lock up. You inhale and you gently hold. So it's going to look like this. You inhale. It's just pause at the end of the breath. Hold and then begin to exhale. So I will count first. So obviously I won't do it fully because I can't count and do it at the same time, but I will kind of mimic. We'll start with 4, and then every minute or so we're going to go up. It's generally, when you begin, don't do this for more than 5 minutes. Once you get very comfortable, if the practice feels very right, by all means. But first couple of days, like 2-3 days, don't do more than 5 minutes twice a day. You don't have to do this long. It's very balancing practice. So the major importance of this breath, it's actually neurologically balancing. There has been some information of using this for POTS. That's particularly what we're doing it for. So, you know, definitely Steve, definitely Janet, definitely Stephanie. So you guys definitely try that. Victor, you know, those of you who have the autonomic instability raging, still definitely try it. You may find this much more effective than lots of other breathing practices you've done. Steve, have you practiced this? Nestor does not.
Yes,
you
I have.
Nestor talks about this practice, but he actually doesn't he doesn't take it way out. In fact, the person who popularized it the most is Huberman. So if you go to Huberman podcast, he has a 2-hour talk that has like 40 minutes about box breathing and how it's like this original. It's the same principle as the 4-7-8 breath. It's original pranayamas. They borrowed all these techniques from yoga, and I mean they should give it a credit, but it's not much.
Yeah, I've done box breathing through yoga for years, but I haven't thought about doing it outside of that.
And I bet you haven't tried to grow it.
No.
That's it. The trick with the box is not to stay at 4. You have to keep moving. So I can easily get it to 10. I'm not kidding. That means that I'm breathing at a 1.5 times per minute. You should try. My suggestion is don't force yourself. Definitely get yourself to 6 within a week or so. If you can't keep going, you get to some ceiling, like probably within 2 weeks, you're going to get to personal ceiling. Just stay at that ceiling for a while, and maybe a couple of weeks at least, and then see if that actually generates the benefit. Just keeping it at 4 or 5 or whatever, it's not going to give you a long lasting effect. The whole point is progressive training to be able to hold in that exhalation, in an exhale state. If you could potentially just inhale, exhale, and hold. For whatever reason, I see a lot of people saying don't do that. I can't quite understand exactly why. I would expect that to be even more effective, but I think it's because in terms of general neurologic vagal balancing, that's probably why. Nestor has the whole chapter on just training exhalation prolongation. But I just suggest do the box, actually. I think it's actually in some ways better. All right, so any other questions about that before we get going? We'll do 5 minutes. I think that's a max for starting anyway. And I'm not going to time it. We'll just keep going until we'll get to 6. So we'll do 4, 5, and 6, and then we'll do like 2 minutes of 6. So that would be like 4 breaths roughly. 4 minutes. Let's do 5 breaths, but we'll start with just 4. Okay. You don't want to be standing for it. That's the only thing. So make sure you're sitting or laying down or reclined or whatever it is. So let's inhale together. Exhale and begin. So inhale 2, 4, hold 2, 3, 4. Exhale 2, 3, 4. Hold 2, 3, 4. Inhale 2, 4. Hold 2, 3, 4. Exhale 2, 3, 4. Hold 2, 3, 4. Inhale 2, 4. Hold 2, 3, 4. Exhale 2, 3, 4. Hold 2, 3, 4. Keep your own pacing on 4. If you're struggling, modify, go down to 3. I would like to wait for everybody to make sure everybody's comfortable with this. If you're not comfortable, we're about to go up to 5. Don't go up to 5. Just stay wherever you are. It's your pace. Okay, so let's I'll just finish up 4. And then if you're already finished, just breathe normally for a minute, a couple of seconds, and we'll go up to 5. Okay. All right, let's go up to 5. So inhale 2, 3, 4, 5. Hold 2, 3, 4, 5. Exhale 2, 3, 4, 5. Hold 2, 3, 4, 5. Inhale. Hold 2, 3, 4, 5. Exhale 2, 3, 4, 5. Hold 2, 3, 4, 5. Inhale. Hold 4, 5. Exhale 2, 3, 4, 5. Hold 2, 3, 4, 5. 2 breaths of your own. I'm going to do with you. You can start closing your eyes if more convenient. Okay, let's go up to 6. So I'm not going to count. I'm just going to do the practice with you. But go up to 6. Again, if you're struggling, keep staying at the lowest comfortable level. Don't keep increasing. Okay. So those of you who are very comfortable at 6, you can go up to 7 if you want. Otherwise, let's do 2 more 6 breaths and we'll stop at that. Okay, so this was, I think, about 6 or 7 minutes in total. There was a little break in between. So don't do longer than this. And I do suggest that you start with, next time when you do it, start with a 4 still and keep going up. Even if 4 felt very easy, still start with 4. And I don't know if, did anybody needed to go below 4?
Yes.
Okay, so just be wherever you need to be. It's okay. You will grow it gradually. It's just going to take a little longer. It's no problem. A lot of this depends on who was air hunger at exhale. 1. Okay. Who was more air hunger when you were inhaling? Like before you needed to inhale, like at that moment. Okay, so what about everybody else? Where were you most air hungry? Or you were not air hunger at all?
At the hold,
At the hold.
at the hold on the exhale.
Right. Well, so that is the point. So if you had most of air hunger at the hold and exhale, this practice is for you, not just for balancing, but for training the system to be more resistant to the rise in the carbon in the CO2. Okay.
I weirdly had the hunger. On the inhale, near the end of the inhale, I couldn't keep inhaling. I was done inhaling. I didn't want to inhale anymore.
That's because your diaphragm is weak. That's it.
I felt that, but also on the exhale, like I felt like a skip almost when I tried
Right.
to.
So you probably, like, multiple problems can happen simultaneously. I mean, I don't want to diagnose you just based on that. I'm just trying to help you to conceptualize the whole process here.
So the diaphragm is like a muscle that you have to just train like anything else.
Exactly, just like any other muscle. And it's one of the muscles that we can't easily sense. So we have to engage it in other methods. So you could do this practice with a breather in your mouth. Good luck. I mean, I haven't tried it. I got the equipment, but it hasn't arrived yet. I just finally ordered it. But you can definitely do it.
I felt like I had a yawn every single time I was holding the inhale.
Interesting. You know what that probably means? That it's so profoundly balancing for you that it drops you into parasympathetic tone. That's possible. I mean, my suggestion to you, Janet, measure your pulse while you're doing it, especially if you have something like a Fitbit or whatever. Just keep an eye on, if you can put it on a screen, keep an eye what happens with the pulse. It wouldn't be surprising if you're going to notice a pretty immediate drop to like more steady and more slow pulse, especially if you're running fast, if you're tachycardic.
You know, one of the things that I really learned, I used to be in acting for a long time in theater. We do lots of breath techniques, and we would concentrate on our stomach. And we were young in college, right? And we thought when you breathe in, your chest expands. And our acting teacher taught, no, your stomach expands. But as good as that was, I always thought of my stomach going forwards. And only recently did a yoga person tell me, no, no, no. You want to think of your entire circle of the diaphragm opening, not just your stomach instead of chest, but the whole, your back too, as a circle. That really mattered to me.
Right. And, you know, the abdominal breathing is powerful and wonderful, but believe it or not, most people do it wrong. So I can't effectively teach you that, believe it or not. You could try. I mean, one of the easiest ways, just put the hand on the stomach, and when you inhale, make sure the hand just comes out, but it's still not perfect. So I actually feel personally that the resistance breaths are better for training diaphragm than abdominal breathing, unless you're doing a lot of abdominal breathing during yoga or some other practices. Then of course it's also going to work just fine. But you know, we just did this one today, but it's definitely a legit approach. Legit approach is to kind of keep learning a deeper abdominal breath, because it will engage the diaphragm. And it's not a, you know, in some parts of the world, the abdominal breath is a standard. That's what kids learn from being little. That's not a typical like Western societies. That nobody learns this as a child. They're just, you actually don't learn any breathing. You just breathe. But there are societies where they actually teach it. Yeah, so she was asleep. Text her, tell her that it's okay. We're good.
Dr. Kogan, I think another thing Nestor talks about, I don't know if it's taking this a step further, but after exhaling, actually holding it for as long as you can, right? And so I don't know if that's just
That's
in
right.
addition to the type of box, but I couldn't do it like a lot of other people. I was starved
That's
holding
exactly
the
right.
exhale.
So Nestor teaches you to exhale and hold as much as you can. And you could, my suggestion is, if you interested in this, try to periodically check yourself, see where you can live in terms of how long can you hold an exhale. Believe it or not, and this is where the shock comes in. Nestor made a claim in the book that you have to cross around 40 seconds to be considered healthy human being. I will tell you, when I first started doing this, I was barely making to 30 seconds. I challenge you right now, most of you will not even make it to 25 seconds. I mean, it's insane how difficult it is, because none of us learned that. Now, in the past year that I've been doing this more regularly, I think I can get close to 40. But even now, after practicing it for a while, it's still. And again, this has nothing to do with physiology of the depth of breathing or the strength of diaphragm. This is the brain acclimation to the rise of CO2. It's completely different principle. It has nothing to do with the physiology of the lung contraction and expansion. It's all about tolerating. And this is like, if you look at the swimmers and the most effective divers, that's what they're learning. They're not learning to take a deep breath, and they do that, of course, but the first thing that they've all taught is how to tolerate the rise of CO2, not lack of oxygen. We can do a lot longer without oxygen for 3, 4, 5 minutes. But the air hunger comes from first and foremost from it's actually bicarb sensors. They're not CO2 sensors. They're pH sensors based on bicarb. It gets physiologically unnecessarily sophisticated. It doesn't matter. For us, it's easier to think of a gas exchange, not of a blood physiology.
So I shouldn't be limited by asthma or diminished lung capacity? No.
Well,
okay.
you probably could be, and you probably are, because asthma, you always overbreathe. And when you overbreathe, that's when your CO2 is the lowest. When you breathe short and frequent, you get enough oxygen, but you constantly breathe out the CO2. And that's why you're completely unaccustomed to any rise.
Okay.
It is more of it's a sensory system. That's why you hear all the teachers in any tradition say, learn the deep, slow breathing. They don't just say deep, they always say slow, because it starts teaching you to have a slow exhale, and with or without hold, it doesn't matter, because the moment you start exhaling, the CO2 starts rising. So, but holding on exhale is the best, because that's when the rise is the sharpest. So challenge yourself, get yourself to 30 seconds if you can. Now, I don't think that is going to translate to you feeling magnificently better quickly. It's pretty slow shift. And the practice of the box is much more important, I think, for all of you, just because of the more of a balancing, a neurologically balancing effect. Increasing capacity to stay off of to stay on a rising CO2 is a long-term goal. It's going to take a long time. But I don't know if anybody's felt the shift. Did anybody felt any different? Yeah, what'd you guys feel?
I feel like that knot that I was talking about is not there anymore.
Oh.
I don't have an explanation for that.
That's good.
I feel much more
Sleepy?
yeah,
That's
I
it.
do.
That's good. Yeah, that's what I feel all the time. Like when I do this or for, it's interesting for me, whenever I do this or 4-7-8, I get sleepy. That's because, naturally I'm hyper. I mean, I have ADHD, and of course I'm more hyper. And so I like anything stimulating. So the moment I drop, the sort of the body's innate desire to cool off and go into relaxation state kicks in. If you're more of a chronically fatigued, you may have the opposite effect. You may find the practice be energizing. Don't be surprised. So again, the practice will depend on your physiology. I'm never fatigued. I mean, once in blue moon if I, did something, but well, it's not a blessing, trust me. I may actually take fatigue over being hyper all the time. It's better to be balanced. That's why, that's why I have to do tons of breathing technique to constantly sort of drop this ever rising level of excitation. But the beauty of balancing practice, anybody could do it. Like there are techniques like 4-7-8, you have to be careful. The techniques like a fire breath, you have to be careful because it could be too stimulating for some people. But like quick coherence that Anne was talking about, or the box breathing, it doesn't matter. Like it doesn't matter where you are on the spectrum. It's going to be beneficial just because they're all balanced. They will bring you more to the center no matter where you are. So,
I mean, I've been doing the coherent for like 10, 12 minutes at a time. Is that okay?
I think that's what the HeartMath recommends, somewhere between 10 to 20 minutes. So I think you're right.
Okay.
This one, don't do this for more than 5 minutes at the target length, though. You could start out with 4 and then grow it, but don't do the more challenging holds for more than 5 minutes. You will actually understand why once you try, because it's going to feel a little exhaustive, and you don't need to go there. It's not going to be any more beneficial than somewhere between, I think the sweet spot is somewhere between 3 to 5 minutes. So don't overdo it. There's no need for that. But you can do it several times a day. Like if you really like it, there's no reason why you can't do this every 4 hours or something. It only takes 5 minutes, so you may take a little break and do the practice. So that's kind of an advantage.
I use that alternate nostril breathing that you showed us a lot. I do that like every day. If especially I feel like anxiety building, that has become something, and it's like fast to do. It's like a minute, 90 seconds.
Anybody who was kind of quiet, do you have anything you want to share?
We talked about measuring. I was sent home from surgery with something to breathe into. Is that the type of thing that you're talking about?
Yeah, they give you that incentive spirometer after surgery. Yeah, so that it helps you to keep your lungs expanded. That's one that prevent what's called atelectasis, which is a post-surgical lung collapse. I think Jim wanted it to. Here's it, James. This is for you. Like this is the link to HeartMath video from our class. Actually, it's open to general public because I see there's 70 views, so it was more than just you guys. I will save all the chat, and I think I can do that, and I will. Yeah, there we go. And I will put the whole thing in the YouTube video when I get to do it. So, anybody wants to say anything for the closing? Anybody has a poem or something? How are we closing? I forgot. We don't have anything special. And we have the opening, right? We have the sharing. Okay. Well, any closing remarks?
Thank you.
Everyone have a good week.
Thank you.
Thank you. Hope Ashley's better.
Yeah.
Thank you.
Yeah.
So I think Steve and Patricia, right? You guys have something you need to talk to me about?
Yeah.
So you guys just, who needs to talk to me? Stay here or Janet? Whoever.
Oh no, that was just a wave.
Ah, okay.
Bye everyone.
All right.
Thank
So
you.
I think
Bye.
hopefully she'll be back next week. And I'm going to stop recording. So,